you give us an overview of margin?
Yeah, margin is a kind of new concept in healthcare. We focus only on outpatient facilities like surgery centers. And essentially what we do are two things. We renegotiate the price of every line item of everything they need to deliver care to their patients. And then the second piece of what we do is we are a technology company. So up to this point, hospitals, doctors' offices, et cetera, could only order by calling their sales reps. And so what we've created is a platform for them to manage every part of their inventory management with one platform. They can order from every vendor at one time with one purchase order. And so that's what we do. We are completely in the supply chain space for healthcare.
Okay, wait. So for surgery centers, those are non-hospitals. Those are like the offices you go to where there's a doctor there and they do something.
Yeah, so those are the really happy places you go for care. They're usually very well built. They aesthetically look nice as opposed to a hospital that just has that old green tile. And this is where they do procedures that you can be in and out in the same day. So there's no overnight stay, no real complex procedure.
Okay. And so when you talk about not having to order from your sales rep, does that mean that people at surgery centers before margin were doing all of their supply ordering over the phone?
Yeah, mostly over the phone, about 80%. So they would call their rep. Rep would be in a surgery covering somebody else. So they'd miss the rep. The rep would call them back. Now they're in a surgery. They call the rep back, and finally the rep's running across town and they write the purchase order number on their scrub pants. The other mechanisms is they can call into an 800 number, but we all know how horrible that experience is. And in some circumstances, some individual companies might have a portal to order, but you're juggling 15, 20 different logins and trying to navigate everyone's kind of software system. So
this is a hell of a job. Is this usually one person or more?
Usually it's one.
It sounds like a lot of work.
It is. I'd say our average customer before margin probably spends 5 to 7 hours a week managing supplies. And that's on top of a full day of surgery. So you're standing there on your feet all day in lead. So usually it's 1 to 2 staff members. But for us, what we found is they're really highly paid staff members. You know, these are $100,000 nurses or x-ray techs. They're truly just ordering supplies.